Hi everyone, myself Gnaneshwar Vishnu Dole, Department of Pharmacology and Toxicology from SBNM College of Pharmacy, Mahad. Such a pandemic COVID-19 situation, we get online lecture platform conducted here. Today's given topic name is route of administration of drug. From these are the learning outcome from these topics. The learner will able to understand the route of administration of drug and they know the effective route for drug dose administration. Let's see the introduction of this chapter. We firstly see the definition of route of administration. Route of administration is the path by which drug is brought into contact with body. Means that the different part of body through the drug is administered. In today's world, medicine or drugs are available in various forms, such as tablet, capsule, ointment, cream. These dosage forms available in liquid, solid or biophysic form. Administration of this such a different type of preparation also different route. Let's see the various route of administration or classification of. In that, the route of administration are divided into two ways. First, systemic route or local route. In systemic route, the systemic effect are occurs. The effect, what is systemic effect? The effect produced by the drug after being effectively absorbed in blood is known as systemic effect. Means that the drug is directly enter into circulatory system and then it reaches to site of action. Systemic routes also can divided in two routes. There is enteral route or parental route. Firstly, we see the enteral route. What is meant by enteral? The enteral is derived from entron, means that is the intestine. In this case, drug is administration via the human gastrointestinal tract. In enteral route, we see oral route, sublingual route, buccal route. Last one is rectal route. Firstly, oral route. By the oral route, a substance is taken through the mouth. Examples such as capsule, tablet. This type of dosage form are given by the oral route. Next, enteral route, that was sublingual route. The dosage form is placed under the tongue and allowed to dissolve in the mouth cavity. The containing active medicament get absorbed through the buccal mucous membrane. The absorbed material is then directly passed into the systemic circulation. Next, enteral route, that was enema route, enema or rectal route also called. This route is used for administration of liquid medicaments such as suppository. Next route was buccal route, where the dosage form is placed between gum and inner lining of cheek. The active medicament absorbed by the buccal mucous membrane, then it goes to directly circulatory system. In systemic next route, that was the parental route. The term parental origin from Greek word para, meaning that the outside, and entron meaning the intestine. Parental route mainly divided two routes. First, that was injectable route and next was inhalational route. Let's see the first injectable route. That route, a drug in the form of solution or suspension is injected into the body with the help of hollow needle and syringe. Injectable route involve following route, that was the intradermal route, intravenous route, intramuscular route, subcutaneous route or intra-arterial route. We see the next lecture we detail upon on that route. In inhalational route, in these routes a wafer form of fine droplet of drug are inhaled in the respiratory tract system to diagnosis. Local route, this route drug is administered topically or directly to the surface of the skin. This includes topical dosage forms such as creams, ointment, lotion, gel. Let's see the first route, that was the enteral route. Enteral route, first in this route the drug is given by through the intestine, it goes to intestine. Drug goes into intestine. Enteral route can be divided into oral route, sublingual route, buccal route or rectal route. We detail see the here of that route. First, that was the enteral route, oral route. In this route, drug, whether liquid or solid preparation, is placed in the mouth cavity and is swallowed along with the drink such as water, milk. After administration of drug by this route, absorption drug takes place in intestine. By the oral route, examples such as tablet, capsule, syrup. These drugs are given by oral route. Advantage of this route. This route is mostly convenient because it can be self-medicated or administered, pain-free technique and easy to take. When given the orally drug, it can be absorbed whole length in gastrointestinal tract. As compared to other route such as parenteral route, it is a cheap or dosage form. Drug by this route, no need complicated process such as sterilization. Disadvantages of oral route. Onset of action is very slow because the orally given drug is absorbed by the intestinal tract, then it goes to the circulatory system, then it reaches to targeted site. Irritant and unpalatable drug cannot be given by this route because the taste should unpalatable substance be never given by the orally route. Patient showing the symptom of vomiting and diarrhea cannot consume the drug by the oral route. Next, 100% absorption is not possible as the drug degraded or destroyed by the digestive enzyme. It is not useful in emergency cases because unconscious patient never get the orally given drug dose. These are the left-directed question for student. Pause the video and think about that question. How to select route of drug administration? How to select route of drug administration? I will explain that question's answer. Route of drug administration determine our route selection by this knowing, first of all, in that the physical character of drug. The physical character of such as solubility, permeability or their absorption rate can be important. Physical character are determined. or route of selection by this knowing. Next, that was the time which drug is absorbed and released. The particularly the rate of absorption or rate of distribution require time to be absorbed from the site of application, applied or administration site. So that can be important in route selection. Next point, the need to bypass hepatic metabolism. When the during the preparation of dosage form or incorporated dosage form, there should be the needed route of administration that has to be required to need to bypass the hepatic metabolism, because bypass the hepatic metabolism, the drug gives to 100% bioavailability in or 100% absorption given that the site of administration. Accuracy of dose. When the decided our selection route, there should be the dose accuracy must be needed to for the different type of route or type of therapeutic effect. Next, condition of the patient. There should be the condition for the deciding route of selection. It will be patient type such as unconscious or consciousness patient. There should be administered drug dose. Thank you.